Да, войдите.
Hello, my name is Jonathan. I'm going to be the nursing student taking care of you today. Can you tell me your name?
Елена.
Your name is Ileana?
Елена.
Okay. Can you tell me where you are right now?
Мне болит голова.
Okay. So, my patient doesn't seem to speak English and seems to be a little confused, so I'm going to call an interpreter. Hello? I need an interpreter for Russian, please. Okay, here we go. Hello, can you understand me now?
Yes, hi.
Hi. I just wanted to make sure that you're doing okay. My name is Jonathan. I'm going to be the student nurse here to take care of you today.
Okay.
Okay. Can you tell me your name and your date of birth?
Елена.
Okay, and your date of birth, please?
I'm 84.
Okay.
You can count when
Okay,
I was
I'm
born.
check here. Okay, wonderful. Do you know who the president is right now?
Of Russia?
No, of America. Where we are right now.
No.
Okay. Do you know where you are?
On the bed.
Do you know like what city you're in, what location you're in?
No.
Okay, very good. Well, if it's okay with you, I'm just going to do an assessment real quick, check you out briefly. Okay. Are you in any pain right now on a scale of 0 to 10?
Yes.
Can you tell me how much pain you're in? From 0 to 10, just the number that's
6.
6. Okay, and where is your pain located? Okay, in your
Right
head.
here.
Okay, right there. So you have a headache?
Yes.
Okay, very good. I'll see what we can get to help you with that, okay? So I'm gonna just check you out now, real quick. I'm gonna look, I heard that you had a fall when you were at home. Is that correct?
No, I don't remember this.
Okay, all right. They found you on the floor?
Can't be true.
Can't be true? Okay. Well, can you, check here.
Where's my earrings? I had the
we
earrings.
have your earrings. They're safe. We'll give them back to you as soon as you're ready to go.
Oh,
home.
my jewelry.
It's all locked away in the safe. It's gonna be okay, Miss Elaine.
It was gold.
Yes, ma'am. We have it passcoded and locked away. Don't worry about that.
Okay.
Okay. So I'm gonna check your eyes here. Can you open your eyes? Just looking at your pupils there. Okay. Very good. Can you follow my pen for me? Very good. And then I'm going to bring it away. Keep watching it. Excellent. Okay.
You made me tired.
Are you getting tired? I'm so sorry. I'm almost done. I'm going to try to speed up here, okay?
Yeah.
So I'm going to need to listen to your heart for just a minute, okay?
Okay.
Okay, and also I'm gonna check your breathing, okay? So I just want you to breathe in and out, okay? Breathe in, breathe out. 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 Okay. Can I have you sit up? I'm just going to listen to your breathing on the back.
How?
I will help you. Okay. Breathe in.
Behind.
Breathe in, breathe out. 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 Okay, very good. Now I'm just going to feel your pulses here. skin turgor. Very good. Look at your cap refill. Very good. Can you just grab my hands here? And squeeze. Okay, excellent. Good job. Just gonna check your feet. Okay. Very good. Now I'm gonna go and I'm gonna get some medications ready for you, okay?
Okay.
Thank you very much. Aha. Hello, Miss
Yes.
Elena.
Hi, Elena.
It's Jonathan back again to give you some medication. So I have some meds. I did my first and second med check already in the med room. So can you verify for me your name and your date of birth?
My name is Elena. I'm 84 years old.
Okay. Very good. Very good. So I have a couple medications here for you. One of them is called enoxaparin sodium. That's an injection that we're going to give you in your stomach, and it's a blood thinner. So what that does is that's going to help prevent any blood clots in your legs or to travel up into your heart. If you have any bleeding or if you notice a bruise or a rash anywhere, I want you to tell me right away after I give you this medication, okay? Don't take any aspirin or any other type of NSAID, like aspirin or Advil or anything like that while you're on this medication, because you can bleed very easily. If you have any kind of cuts, I want you to tell me right away, okay?
On my finger.
Is it bleeding right now?
No.
Okay. If it's bleeding, any cuts that are bleeding, okay? The next medication I have for you is called docosate sodium. It's a stool softener, so this is going to help keep you from being constipated, okay? It's just for a short term. It's not a medication you want to use over a long period of time. And it's not for an urgent use, it's more of a preventative. We want to keep you from being constipated, okay?
Okay.
You need to take a full glass of water. You have water here, right?
Mm-hmm.
Okay, and this is going to be just a tablet that you take. Do you have any abdominal pain, nausea, or fever, or vomiting, or anything like that?
No.
Okay, you don't want to take this if you have any of those. And you might have some throat irritation, or diarrhea, or rashes that could happen when you take this medication. The next medication I have is called Furosemide. Another name you might have heard for it is Lasix. This is just going to make you pee a lot. It'll help with your swelling in your legs, and it'll make sure to take fluid that might be building up around your lungs away, okay? So with this medication, I want you to make sure and change positions very slowly if you're getting up, because you might get really dizzy, really lightheaded. You might have some orthostatic hypotension, which means low blood pressure when you stand, okay? It might result in blurred vision, dizziness, headache, vertigo. You could have instances of constipation or diarrhea, and we're going to need to check your eye and nose very carefully for this medication, okay? That's how much you're drinking and eating and how much you're putting out with peeing and going to the bathroom, okay?
Mm-hmm.
So that's very important. I also have a multivitamin. This is just like a normal vitamin you might take at home. This just has all the vitamins that you need to kind of help with your healing, help keep you strong. The side effect of that is it could be, might cause diarrhea, constipation, or
I
nausea.
don't want diarrhea.
We hope you don't have that. It's a very small chance of having that side effect. But I have to tell you about the side effect, just so you know, so you're informed.
Okay.
And the last medication I'm going to give you is called metoprolol, and it's for hypertension. You've had some high blood pressure lately, so we're going to give you this medication to help with your high blood pressure, okay? And I just took your apical pulse. That's checking your heart with my stethoscope. I wanted to make sure it was above 50 beats per minute, and it is. So this is another medication that can cause you to have low blood pressure. So be sure and call me if you need to get up or do anything like that, okay? You need to make sure and take this just as directed, okay? Don't skip any doses, don't hide any medication. And this is a very, it can really change your blood pressure drastically. So just take it as I give it and as your doctor orders it at home, okay?
Mm-hmm.
It can cause a lot of the same things: fatigue, weakness. It can make you a little anxious or have depression. Same things: diarrhea, nausea, or vomiting. So any of those symptoms with any of these medications, I want you to tell me, okay?
Okay.
So I'm gonna scan your armband here. This is the MAR. Check the frequency. I'm doing my med check number 3. Enoxaparin, 40 milligrams. That is this. Checking that to the MAR. Okay, this is deficit sodium. It's 100 milligrams. Checking the expiration date. Checking to the MAR. Also have a Furosemide. That's 20 milligrams daily, oral. Checking that to the MAR. And then I have a multivitamin. Checking expiration date to the MAR. And last I have a metoprolol, 50 milligrams. We got 2 pills of those in there. 50 milligrams daily. Checking to the MAR. Okay. We can start with these. Do you need to take them all at once, or you can take them one at a time if you'd like?
Okay.
And be sure to drink all of that water with them, okay? Great job. Your family member here seems to be passed out. He's had a long day.
He's tired.
Very tired. Okay. Now the next medication I have is going to be just a little shot in your belly, okay?
I need time.
Sure. Take your time. Okay. You don't have to raise it up. Okay. So I'm going to take the cap off. Check the metoprolol. Not metoprolol, it's enoxaparin sodium. Heparin. I'm going to check it here. Grab a little pinch. Dart. Push it in. Okay.
Ow.
Ow. Now you're going to want to watch that for any bleeding, okay? Any bleeding or bruising under there. Dispose of that. Okay, do you have any questions for me about your medication?
No, thank you.
Okay, well, is there anything else I can help you with?
No.
Okay. I'm going to get your call light here and your bed table there. And make sure that you have enough water and everything. Got that there where you can get to it. Okay, and if you should need me to go to the restroom or for anything, you can just call on your call light, okay? Are you in any pain right now? What's your pain level? Is it still the same?
I think it's getting bad.
Okay. What would you say it is from 0 to 10?
I think 4 it's now.
It's now down to a 4. Excellent. Okay. Well, I will see you in a little bit. Thank you, Miss Elena.
Thank you.
So I'm going to do the shift report, S-bar, on Miss Elena Pernoski. She is an 83-year-old patient, female. She was admitted last night with a diagnosis of syncope and a change in her mental status. She has a history of hypertension, coronary arterial disease, and CHF. She lives alone. So her daughter came in, found her on the floor. She was confused. She wasn't sure what had happened to her. There didn't seem to be any apparent injury, so the daughter called 911. So the EMS came and brought her here. The patient is Russian. She speaks very little English. The daughter said that she would be in this morning. She would be able to help. But until then, I would recommend using a translator phone. As far as her assessment, she slept most of the night. She is awake, she is alert, and she's oriented to person, but she's confused as to time and place. She reorients easily with a little coaching using the translator phone. Her Perla is 3 millimeters. She has a Glasgow Coma scale of 14. She is on telemetry. You're supposed to monitor. She's in normal sinus rhythm. She has a blood pressure of 140/80. Her lungs are clear. Anterior, posterior, they're decreased in the bases with a few bulbocellular crackles. The pulse ox that she's reading right now is 93% on the 2 liters, a nasal cannula. She can move all of her extremities, but she has generalized weakness. You'd need to get an interpreter for Russian. I would recommend 4-hour vital signs with neuro checks, blood pressure while supine, sitting and standing to check for orthostatic hypotension. She needs to have AccuChecks for her blood sugar. She doesn't need coverage, just need AC&HS AccuChecks before and after meals. She has an IV 22 gauge, left hand. She's running 5% dextrose, 0.45% normal saline every 12 hours. She is on bed rest on a 2,000 calorie ADA diet. She had lab work drawn several hours ago. We're waiting on the results for that.